So in checking if your kidney is still functioning well, so for the kidney to function well, that's mean like okay, the filtration through the glomerular filter should be functioning properly. The reabsorption by the tubules should be functioning properly. Then the excretion should be functioning properly. So to check if the kidney is functioning well, there are some type of what tests. Alright, there are some types of blood tests that you need to do and to actually check if the kidney is functioning well or not. Okay, and these tests are the tests that will basically be looking at it at a glance very quickly because they are self-explanatory. The first type of test you could do is urea test, and urea is a waste product formed from the breakdown of proteins. Now, urea is usually what passed out in urine. Now, a high blood level of urea, that's uremia, indicates that the kidney is not passing out urea. Do you understand? So now it indicates that the kidneys may not be functioning properly or that you are dehydrated. That means you have a low body water content. Okay. Then creatinine. We say that creatinine is what a waste product which is made by the muscles. All right. So creatinine passes into bloodstream and is usually passed out in urine. Okay. So a high blood level of creatinine indicates that what the kidneys are not passing out the creatinine that she should. Okay. That indicates that the kidneys may not be functioning properly. So creatinine is usually a more accurate marker of kidney function than urea itself. Okay. So moving now, the estimated glomerular filtrate rate. This is to look at how the glomeruli are working. Okay. The glomeruli, looking at how the glomeruli are working. So now this provides what a guide to kidney function. Now, although the level of creatinine in the blood is a useful guide to kidney function, the estimated glomerular filtration rate is a more accurate measure. Okay, so blood creatinine can be used to estimate the estimated glomerular filtration rate using age, sex, and race. Okay, and this is often done by computer and reported with what creatinine blood test. Now, the normal value for estimated glomerular filtration rate is what 90 to 120 milliliter per minute. An estimated glomerular filtration rate below 60 millimeters per minute suggests that some kidney damage has occurred. Okay, that means the kidney is not filtering at the rate it should. Now, this value becomes lower with increasing severity of the kidney damage. So now, as the kidney is getting more damaged, the filtration is reducing more and more. Then dissolved salt now. Dissolved salts that are routinely measured are what sodium, potassium, chloride, bicarbonate, and they are sometimes referred to as what electrolytes. Now, abnormal blood levels of any of these salts may be due to a kidney problem. Now, some other conditions may also alter the salt balance in the blood. Okay, so this is a blood test for kidney. The urine test now. We said that some urine tests require only a couple of tablespoons of urine, but some tests require collection of all the urine for 24 hours. Now, a 24-hour urine test shows how much urine your kidneys have produced in a day. And if you want to look at the clearance of any material in your body, you collect it for 24 hours. You look at how the kidneys have cleared that material for 24 hours. Okay. So now the test can also give an accurate measurement of how much protein leaks from the kidney in the urine in a day. Okay, the urinalysis now. This includes what microscopic examination of urine samples as well as dipstick. Now the dipstick is a chemical treated strip. It's a dipstick. Okay, chemically treated strip. Now the strip changes color in the presence of abnormalities such as what excessive proteins, blood, pus, protein, bacteria, and sugar in urine. Okay, so now a urinalysis can help to dictate a variety of kidney problems and urinary tract disorders, right? And this include what chronic kidney disease, diabetes, bladder infections, and kidney stones. Then urine protein now. We said that this may be done as part of the urinalysis or by a separate dipstick test. An excessive amount of proteins in the urine is called what proteinuria. So a positive dipstick test that's +1 or greater should be confirmed using a more specific dipstick test, which is what albumin specific dipstick. Okay. Now, or you can actually confirm it by what a quantitative measurement such as what albumin-to-creatinine ratio in the body. How about microalbuminuria? That is a more sensitive dipstick test which can dictate a very tiny amount of protein called albumin in urine. Now, people who have increased risks of developing kidney disease such as what? Those with diabetes or high blood pressure should have this test if their standard dipstick test for proteinuria is negative. So you still do this microalbuminuria test because this one is much more specific. Then how about creatinine clearance? With that, a creatinine clearance test compares the creatinine in 24 hours. Compare the creatinine in a 24-hour sample of urine to the creatinine level in your blood to show how much blood the kidneys are filtering out each minute. Right. So these are what various uh, various types of routine blood tests for kidney function. All right, so that's it, guys. Just looking at the various things that the kidney is supposed to clear out. That if the kidney does not clear out, they will actually settle back in your blood. All right, so that's it, and bye for now.